If you're dealing with low back pain, my question is, how are you bending over to pick something up from the ground? In this video, I'm going to show you why this is important to understand and what you could do to help solve this problem. What's up, guys? My name is Dr. Nick Bonforte, physical therapist. So picking up something from the ground is really important when we're dealing with acute low back pain and it's sparked up. Why? Because a lot of times movements incorrectly can be contributing to this problem, and it can perpetuate if you don't kind of modify the movement in this common thing, going to pick something up from the ground. It doesn't just relate to picking something up from the ground. It has to play a role into maybe like bending down to tie your shoes or take off your shoes, anything in terms of reaching down towards the floor. So which one do you look like? Do you look like this one where when you go pick something up from the ground, you're kind of rounding the whole back to pick that up? Or do you look like this one where your kind of hips are shooting backwards, your back is staying more straight, and you go pick something up from the ground? Now, the differentiation between the two is basically hip hinge mechanics. Now, why is this important is because the back is more susceptible to this flexion loading that is going on. When we have a lot of low back issues, many times it's associated with flexion sensitivity. So when we're bending over from the ground and we're in this rounded position, that could be contributing to the problem. A good alternative to do is up the mechanics and awareness and do more of a hip hinge mechanic as you're going down to pick something up from the ground. Now look, this isn't the end all be all for this type of movement when you're going to pick something up from the ground or bend over and tie your shoes. You shouldn't be moving around like the biomechanics police are looking at you. It's just a good idea to understand when you might be dealing with some of these issues at the low back. This is a potential problem that can contribute to this issue, or it can be the result of many reps the incorrect way that sparks up the problem. So having good awareness of what you're doing when you're moving it, I wouldn't necessarily suggest your whole life you should have a proper hip hinge mechanic going down to pick something up from the floor with, if you're picking up a pencil. But if you're picking up some load like in a deadlift, I'd probably suggest more of this correct hip hinge pattern. But let's get into some of the details with these mechanics. All right, so bending down to get something from the ground, if we're just rounding like this, that creates a lot of a flexion loading at the low back. So we're creating that rounding effect. This is why this position can actually contribute to some irritation to the low back when it's sparked up, or even if it's not sparked up, this repetitive movement of going down like this, if we're not prepared to take on that flexion loading, repeated over time, can start to spark up some of the symptoms to the low back. So a good alternative is using just a classic hip hinge movement to get something from the ground. So we're here like this, we're gonna stay long and neutral from the spine where we're not rounding. The idea is we're thinking about shoving the glutes backwards like this and keeping the spine long. That will give you good spinal alignment as you come up and minimize the flexion loading to the low back. And then the reverse is to lower it. So I can bend my knees, shoot my glutes back as my spine stays long versus rounded. So as it stays long and I lower something down to the ground or pick something up, that will decrease that flexion loading to that region and decrease these spark ups that it can contribute to this region in terms of pain. Now, if it's hard to understand how to do this actual hip hinge movement and facilitate that, then you can use a dowel to help some of these mechanics. So using a dowel is super helpful. So you can put it right on the back in contact with the head, the upper back, and the glutes. And you emphasize the glutes shooting backwards as your chest goes towards the ground. What this does is keeping all contact points with the dowel, it will keep the spine nice and long, limiting the way of rounding from the back during the movement. So from here, head contact, upper back contact, glute contact the entire time as the glutes shoot back, spine stays long, and then you can just basically rep this out to emphasize good hip hinge mechanics. What that can do in the long run is play into how to actually bend down to pick something up when the back is sparked up. So we get good at that, then we could do a hip hinge, actually pick something up without the discomfort versus going down just like this, rounded and picking something up. Now, like I said before, this isn't to be like the biomechanical police looking at you move. You don't want to go through life moving like a robot, but it's good to understand how these mechanics can play a role into maybe the development of low back issues or pain you're feeling, and good alternative that you can do, such as the hip hinge, to pick something up from the ground versus just classically rounding. It's also important to keep in mind that the rounded flexion position that everyone freaks out about, it's all about adaptation to the body as well. If you adapt the body to withstand that motion, it's not a bad motion. It's just commonly we have a lot of things going on in life and we don't emphasize getting strong in that position. So over time, when we do that repeatedly, it tends to spark some things up. But if we adapt our body, because the body is super adaptable and we can withstand that loading and that force, it might not be that bad of a movement. But context is everything. So hopefully you found some value in this video breakdown of the importance of the mechanics and how it's associated with potentially contributing to low back problems. If you did find some value in this, I would really appreciate it to really help out with the YouTube algorithm if you subscribe, like, comment, leave any questions down below. Also, don't forget to turn on your post notifications so you never miss a video once I release it. Also, guys, if you want to learn a little bit more about some programs that I have for this particular region, then check out my website. I'll leave the link in this video or down below in the description. Just click to head you right over to the website. Check out some of the programs where I use my background in physical therapy and strength and conditioning. I combine it into one approach that outlines how to actually make some serious gains to these body regions. Check it out. This is Dr. Nick. I'll see you next time.